the strain on these resources is affecting hospitals right here in Central Arkansas. UAMS is on the verge of not being able to accept patients. The lack of room is really hurting patient care. THV 11's Ashley Godwin has this story.
We're curious if non-COVID patients still are getting adequate and efficient care as they would if we didn't have this surge in Arkansas.
They're not.
1/4 of patients at UAMS are COVID positive, and that number is expected to increase.
It's a terrible feeling. We're stretched pretty thin, resource-wise, both from a personnel standpoint and from a physical space.
Intensive care space is limited.
The number of ICU patients we have in our hospital today far outstrips the number of ICU beds we have available, and so we're caring for those patients in alternative sites.
And wait times longer.
Once in a room, they may be changed to a different room for various reasons. And if they're at an outside facility, they may not have the opportunity to be transferred to our institution because we just don't have the capacity to accept those transfers.
There seem to always be a little more bed capacity available, whereas now it seems that we have met saturation for ICU especially.
COVIDCOM is the transfer system that hospitals can use to find openings for patients across the state. 41 hospitals are a part of COVIDCOM, which was reinstated by the governor less than a month ago after hospitalizations started rising.
Our transfer pattern is very much from one side of the state to the other.
If a patient is transferred, the ride could be up to 6 hours long, wherever an opening is found, even if it's from one side of Arkansas to the other.
So that does add a stress to the EMS resources available to the communities that they normally wouldn't have to deal with.
And if there's not an opening for a patient,
we will put them in a holding pattern in our database and continue to look for open capability and capacity. The hospitals too will keep looking on their own for beds inside the state as well as outside the state.
In Little Rock, Ashley Godwin, THV 11 News.
UAMS told us some patients may even have to wait in an ambulance for several hours until there's an opening. Last week, Governor Asa Hutchinson said 4 patients had to wait in ambulances before being admitted.